Hello, I'm Jonathan Reimer with Smart PT. Today I want to talk to you about rib dysfunction and a good exercise to deal with the most common one that you might see. Most people that I see in the clinic lose their inspiratory movement. So when we're talking about the ribs, the inspiratory movement is an inferior glide and a posterior roll. We tend to treat the inferior glide at the costal transverse joint, and that corresponds with inspiratory movement, as I said. I think part of the reason for this issue is that many people have issues with being stuck in a little bit of thoracic flexion. So thoracic flexion goes a little bit more along the lines with expiratory problems, whereas inspiration, to reach maximum inspiration, requires extension movements. So I think we see, just like we see lots of loss of facet joint extension in the thoracic spine, we also see lots more inspiration type problems in terms of the rib glide. So just because we see a lot more extension loss in the facet joints, we'll also in a corresponding fashion see a lot more loss of inspiratory glide at the costal transverse joint. So how do we figure out how to produce inferior glide at the ribs? Now, what I've thought about in order to make it make sense biomechanically is we need to combine an extension with a side flexion in one direction and a rotation in the other. So if I want to work on a rib problem on the right side, I want to think about what does it take to maximally expand my right rib cage into inspiration for maximum volume. So that requires me to extend backwards, side flex away, and rotate towards the side. As you can see, that right side of my chest now is fully expanded. And from there, if I want to work on rib inspiration, I can add rib inspiration. So deep breaths into the end of that stretch position. So what's a good home exercise to do that? Well, you can simply have the client do just that. You can have them stand about 6 inches away from the wall. You can have them reach back to the wall with the back of their hand, reach over, and as you can see, I'm producing a side flexion to the left, a rotation to the right, and a bit of an extension if I'm reaching back. You get them to bring themselves into the position where they feel that chest tightness, that barrier to movement, and then have them do some inspiratory breaths in that position. Alternatively, you can do another exercise either at your bedside or with an exercise ball, for example. So what I want to do is combine those same elements. I'm going to kneel at my bedside. An arm of a couch works well. If you have a ball, it works well also. What I want to do is produce a side flexion movement. So I'm going to use my right arm if it's a problem on my right side, and I'm going to reach across my body. So I'm going to want to shift my hip to the right side to create a nice side flexion to the left. Okay? I'm simultaneously going to thread my arm through, my left arm through, to produce the rotation to the right side. And then I'm going to drop my chest towards the mat to produce some extension. So I'm going to reach away with my right arm, thread through and down with my left, and drop my chest towards the mat and take some nice deep breaths while I hold that stretch position. So that's the combination of movements that will push that rib towards the end range of inspiration, and then when you add those inspiratory breaths, you're going to get that rib mobilizing self in the stretch position. Check us out at smartpt.ca or on Facebook.